This month's Lunch and Learn with the National Bone Marrow Transplant Link will cover the latest on chronic GVHD, trials, research, and what's on the horizon. Our guests will be Dr. Farid Farr, a nationally recognized expert in the field. Additionally, survivor Steve Hodges will provide his best tips and tricks. This month's Lunch and Learn with the Link will be Wednesday, February 19th at noon Eastern. Sign up for free by visiting nbmtlink.org or just follow the link in our show notes. Welcome to Season 16 of Marrow Masters, sponsored by Sanofi. The National Bone Marrow Transplant Link, established in 1992, strives to help patients, caregivers, and families cope with the psychosocial challenges of bone marrow transplant, from diagnosis through survivorship. Season 16 of our show will focus on the best tips for dealing with chronic graft-versus-host disease. Top-notch healthcare professionals will share their compassion, best advice, insight, and caregiving tips regarding chronic GVHD. This season will offer education, tried-and-true solutions, stories of hope, and more. Now, here's your host, Executive Director of the NBMT Link, Peggy Burkhardt.
Hello, everyone. Today we have with us Krista Wood, who's a registered nurse with the Cell Therapy and Transplant Program at the Victoria General Hospital in Halifax, Nova Scotia, Canada. Krista sees a lot of chronic graft-versus-host disease on the daily as a nurse, and she's going to share her best advice and experience when dealing with GVHD today. Thank you.
Thank you, Peggy, for having me on your show today.
Share with listeners how important it is to let your healthcare team know about anything concerning post-transplant.
Well, it's really important for patients to let us know when anything changes, because with graft-versus-host disease, you want to get treatment as soon as possible. So any little change at all, we want people to let us know, because it might be nothing, but it might be something that's really drastic. So we want them to keep us in the loop. The post-transplant can be a very challenging time with feelings of stress of relapse and developing graft-versus-host disease or dealing with graft-versus-host disease. So communication is really important with your healthcare providers.
I'm so glad we're talking about this. I think it is really important to stress this message again and again. For folks to be prepared, have the phone numbers, feel that they can call and they can ask a question, even if they think the question is silly or too small.
Yeah, I always tell them just anything at all. Like, I'm here to help you and I will reassure you or get you the help you need when those concerns come up.
I have to tell our listeners too, I had the privilege of meeting Krista this fall in Vancouver at a conference, at a GVHD conference, and I saw firsthand the impact that she has on patients. We were in a breakout session and a gentleman could not stop talking about two of you, his nurses, and the impact you had on his healing and his post-transplant recovery. It was just so incredible to watch how often he looked over at you, and you could tell that you did so much for him and obviously went over and above because there was such a friendship there. So I commend you for that, Krista.
No, thank you. It's so nice to hear those things, because that's why we do the job that we do. So we're really happy that we can make a difference in people's lives.
Absolutely. You're doing that every day. So let's talk about blood work and other routine checks that really make a difference, especially at the beginning of survivorship.
So blood work is really important right at the beginning after transplant, many years later as well. But in the beginning, your numbers can change very quickly. So we always want to make sure that we're keeping a really close eye on your blood work. For example, your liver enzymes. We're watching for liver graft-versus-host disease, so we want to make sure we catch that right away. And to know if anything has changed. For example, if you get your vaccinations, your blood work can change. And if we know this, then we know the reason for platelets dropping or anything like that. And other things with routine checks would be like pulmonary function tests for graft-versus-host disease of your lungs. Here at our center, we do post-transplant pulmonary function tests every 3 months for the first 2 years to make sure that we catch anything right away and then treatment again as soon as possible. And other tests that we do would be bone density to check your bones after getting steroids and chemo treatments. And also mammograms, for example, and colorectal screening, all really important post-transplant.
And you could see how people put those things off. You know, they're in the fight of their life.
Yeah.
And it's easy to forget about the routine things that all their friends are getting. And it is so important and so wonderful that the centers do such a great job reminding people, okay, we got over the transplant, but now we got to take care of the regular business and make sure you're healthy in all the other areas of your life, right?
Yes, we're doing the transplant so you can keep on living, but we need to make sure everything else is under control as well.
What a great way to put it. I agree. So, Krista, let's talk about the importance of remembering what you really loved about life pre-transplant and maybe how to get back to that joy in life again.
Yeah, that goes back to the statement about we did the transplant so that you can keep on living. But people have spent so many years of their life getting their chemo treatment and then the workup for the transplant. And then they finally get the transplant and their just sole focus is just to get through this transplant. And then they forget that they need to keep on living after this. So I really like to talk about like what people like to do. Did you work before? What are your interests? Just so people can get back to what they love. Although it's hard to not think about your cancer relapsing and graft-versus-host disease, but I want people to focus on things that make them happy.
Oh, that's really great. It's so important. I love that that's important to you too.
Yeah.
To find those gems, those things that bring them joy. Let's talk about lifestyle changes. Many people are trying to go back to work. They need to go back to work. If they're lucky, they don't. But also, work is a wonderful distraction, I would say. Seeing friends again, the restrictions of that.
Yeah. So I find people who want to go back to work and who are like really eager in going back to work have a better mindset and like focus. But where people, if they're unable to go to work, it's almost like they feel like they're not sure what their purpose is anymore. So I always try and get people, if able to go back to work, to go back to work. Or at least I will try and discuss things with patients like what they like to do or what other jobs they could do. It's good for socialization. It's good to be around other people.
Even volunteering, there's so many ways to give back and, organize a Marrow drive. I think a lot of the volunteers that I work with, I hear stories all the time. It brings them purpose again.
Yeah. I hear people who also volunteer with like the Leukemia Lymphoma Society post-transplant too, just to feel like they're giving back.
Absolutely. And what a great organization they are. They have so many opportunities for people. And, even groups like Health Tree, they have ambassadors and, National Bone Marrow Transplant Link. We always need peer mentors. So it's just a great way to stay busy and feel like you have this purpose post-transplant.
Yeah, for sure.
So, Krista, let's talk about why knowing about GVHD before transplant is so important. And I know it can be tricky. Some want to know everything. Some want to know nothing. Some want to know a little bit or just enough. How do you tackle this?
Yeah, so we always give everyone the same handout prior to transplant, which discusses graft-versus-host disease along with every other thing related to transplant. So I'm sure many don't read it cover to cover. But it is important to know that graft-versus-host disease is a very high possibility after transplant. So how much you want to know prior to transplant is up to you, but it is important to know that it is very likely to happen. If it's mild, moderate, severe, time will tell what's going to happen, but it's important to know. So many people after transplant, they get to me and they don't really remember much about graft-versus-host disease because they're just trying to focus on the transplant itself.
Mm-hmm.
So we bring it up again after transplant and explain it in depth then when they're more likely to absorb the information a little bit more.
Okay.
And it seems to work that way. We keep giving the information, but sometimes information overload is definitely a thing. So it's hard for them to retain all that information.
It sounds like that's a great approach. Everybody gets the same thing. They can ask questions. You kind of give it to them in increments.
Yes.
That sounds like a smart approach. So can you predict who is going to have the toughest time? Perhaps who's going to get GVHD?
For graft-versus-host disease, if you had a stem cell transplant instead of a bone marrow transplant, that puts you at higher risk for graft-versus-host disease. A female to male transplant donor puts you at higher risk. And sometimes going into transplant being a little more deconditioned can put you not necessarily higher risk for graft-versus-host disease, but higher risk for just your body being like put through the ringer really and having a hard time to get back to yourself after transplant.
So, Krista, what exactly do you mean by deconditioned?
Just going into transplant, sometimes the chemo really knocks them down. So they're feeling really fatigued and not a lot of energy, not exercising much, not eating as well as they used to eat. But transplant has to happen at that time. So sometimes people aren't at their best version of themselves prior to transplant. So it's a little harder for them to get back to their physical level after transplant.
Yeah, that's such a good point. And really, pre-transplant, as hard as it is, just to be trying to do all these things. We've heard this before, tip-top shape if you can before transplant, which is such a tall order with everything that you're going through to get ready for transplant.
Yes, it's definitely hard with all the chemo and treatment that you would have even received before that, even like years before that. You might not be at your regular self for years.
I'm going to put you on the spot here. Are there any tips for that preconditioning to have more favorable results? Is it short walks? Is it any dietary suggestions that you've noticed through the years?
I wouldn't say there's anything specific, but just in general, we always try and make sure that people are keeping up with their hydration and eating well and trying to exercise at the level that they can prior to transplant, just so you're at your best that you possibly can be.
Yeah, the hydration is a very good point. And that's not the hardest thing to do.
No.
Excellent point. Thank you. Krista, let's talk more about advocating for yourself and even the role the caregiver can take in making sure that the advocacy is happening.
So as a patient, you know yourself best. So we want you to bring up any concerns that you have, any changes with yourself. You know yourself best, so you have to be your voice. Where the caregiver is the person that is watching you day in and day out. So they are able to see the progression that you're making. Maybe you went for a walk for 5 minutes one day and then 10 minutes the next day. To the patient, that might not seem like anything, but to the caregiver, they notice that there is some change happening. So they can be a cheerleader for the patient as well. And also in the other direction, if they notice things getting a little worse, then it can also be the voice for the patient.
Oh, it's so important. Our caregivers, they are the unsung heroes, aren't they?
Yes, they're so important.
And it's a long haul for them as well.
Yes.
What about making sure they can get in touch with you? Let's talk about that a little bit.
In our center, we see the patients and we give them our contact information. We're a little separate from the rest of the hematology clinic here, and we're a cell therapy and transplant. So sometimes it's a little harder to get a hold of us because we're a smaller part of the bigger practice. So we always give patients our information, our direct phone numbers and our emails as soon as we see them. And that way they can talk to us and we're their first line of communication. And if there's anything that we can provide them with at that point, we would do that. But if it's beyond us, then we would talk to the transplant physicians and get them involved if they think they need to be seen at that time or what can be done.
Okay. What's the biggest call you probably get the first month after transplant? What is it about?
I find within first month, first year, several months, is patients are calling about things that aren't really related to transplant, but they're just really nervous at that point. So they could be just calling about my leg is sore or this hurts, and they're just worried that something is coming back. So a lot of times it's stuff about like they just need to be reassured that things are okay. We're monitoring their blood work and that sort of thing. But people do also call about their blood work because they're so focused on their hemoglobin level, their platelets, because they've had so many transfusions. So they do call about those types of things. But sometimes it's just smaller things that they need some reassurance about, or if it's normal or not.
I really like that. And to know that you guys do such a great job. I know you do. I've seen firsthand your patients putting their minds at ease. And that tells me that's what we need to do more of as an advocacy group, as a nonprofit. We need to give them programs that really tackle right after transplant,
Yeah, for sure.
What's normal, there's never a dumb question, that kind of stuff.
No, I always try and just get them anything at all. I want to hear it. And then I'll let you know if it's concerning or if we're happy with that or what's the case.
Oh, this is great, Krista. Thank you so much. Let's talk about post-transplant. You're getting back in the swing of things. There's vaccinations that you have to get to, dental appointments, things like that. I know we touched on it earlier, but again, why is that so important?
So vaccinations are so important because after their transplant, it's basically like they're a baby again. They have no protection against anything. So we want to get them started on their vaccines as soon as possible because they are at risk for getting anything really. So we start that as soon as possible. And we recommend that they also get their yearly flu shots and their COVID vaccines and all that types of those things. Even years after their regular vaccines, we still recommend you keep up to date with those. So dentist appointments are really important too, because after chemo treatment, your mouth can be super dry and you're at higher risk for cavities in this situation. So people who don't go to the dentist, they'll be years without going to the dentist and they'll have 10 cavities that need to be fixed. And so many other things can happen in your mouth too that puts you at risk for heart problems. And we want to make sure there's no abscesses or... So people can be at risks for other types of cancers, such as tongue cancers after having received other types of chemo. So we just want someone to be checking their mouth. And it's the same screening as the general public. You're just at higher risk than the general public. So we want people to be getting their teeth cleaned and checked out.
Absolutely. So Krista, let's talk about post-transplant diet and physical activity. This is so important to get back in the groove, get moving, stay moving. Any advice for your patients on this?
So immediately after transplant, I don't want people to focus too much on diet and exercise. I would like you to stay hydrated and eat what you can, but I don't want you to overstress on eating the exact amount of fruits and vegetables that you're supposed to have and the protein. I want you to eat what you can eat. Don't make yourself sick. And just focus on what makes you feel good at that time. And then as months go on, you're going to start feeling better. You're going to start feeling stronger. And then you can start incorporating more exercise into your daily life and eating 3 meals a day. Some people only eat 1 meal a day at the very beginning and then slowly incorporate more meals into their day. So just start slow and just take one day at a time.
Great advice all the way around, for sure. So, Krista, how do you handle it when sexuality issues come up? We know this is, just an important part of life.
Yeah. Most patients don't actually bring it up themselves. I tend to bring it up with them because I know people can be uncomfortable with that. So it's also really important with the graft-versus-host disease aspect of it as well, because there can be skin graft-versus-host disease, which can affect both males and females, and vaginal graft-versus-host disease as well. So I try and bring it up right away. Depending on the patient, you can kind of tell where people are, but I try and bring it up right away. And then some people say like, oh, that's not an issue right now. Bring it up a couple months later and they'll say, yes, that actually is an issue. So then we can address it at that point and we can consult gynecology to get involved if we're having concerns. And we try and bring it up as much as possible because we know people aren't going to bring it up to us. And people always are really happy when we bring it up because they're like, oh, I didn't realize that could be an issue. So it's a part of everyone's lives. So it's important to bring it up.
Good for you because, doing this job as long as I have, I know that it can be a delicate topic and hard for a lot of people to bring that up. So kudos to you that you do that for your patients.
Yeah. And you can tell when people don't want to talk about it or I don't push it or anything, but I just like to bring it up and keep bringing it up just to make sure we're not missing something.
Yep. And sometimes when your doctor's asking you questions, I just thought of this, you feel sometimes like, oh, yeah, now I can talk about this. I can answer this.
Yeah.
So I think it's a really great idea. And of course, the nurse too, any healthcare professional.
Yeah, the doctors are really happy that we, I don't think they want to bring it up either, to be honest. So we bring it up and the doctors are really happy we're bringing it up too. So.
Oh, that's interesting. Good for you.
Yeah.
So, Krista, we all get caught up in comparing ourselves to each other. How do you navigate the individuality of GVHD for each of your patients?
So this comes up quite a bit. They want to compare themselves to other patients who've gone through what they've gone through. So just the other day, I was talking to a young man in his 20s, and he was asking, when should I be going back to work? And I said, it doesn't matter when you go back to work. It's all up to you. Do you feel ready to go back to work? If you don't, let's take it a couple more months, and then we'll readdress it then. I really try and make sure that people know that just because you both had a transplant 1 year ago doesn't mean you're not the same person. You didn't go through the same thing. So it just depends on the patient every time. So I really try and make people aware that just because someone else is doing it doesn't mean it's what you're supposed to be doing. You take it one day at a time yourself.
Oh, this is great. So it can be a long haul with GVHD. Some people sail through it. I mean, I know people 8-9 years later. There seems to be a slow burn, though. It gets better and better. And quite frankly, in a few cases, it doesn't. Mm-hmm. How do you handle, that the new normal can be a phrase that isn't really loved sometimes, but really helping people accept that this is your life now?
Yeah, I find that the most common thing is people have a lot of fatigue after transplant. And some people ask, why isn't this going away? And you have to let them know that sometimes this is just how it's going to be. But it's a very sensitive topic as well, because people don't want it to stick around and they want to go back to the way they were. Mm-hmm. So it's important to be sensitive with these things, but just to let people know that they're not alone. Lots of people struggle with this, and just you really have to pace yourself. And again, like I've said, take one day at a time, but sometimes these things don't resolve completely, and you get to know your body as time goes on and know what you can tolerate and how much you can do in each day, if you have to take a nap in the afternoon, and people adjust and adapt to this.
Mm-hmm. And maybe tackling the harder stuff in the morning, the thing that's going to be the most taxing.
Yes.
So, Krista, do you have maybe a story of a survivor, something to encourage folks to keep on keeping on?
Yeah, so I do have some patients who I was able to wean off with the help of the transplant physician, of course. I wean off immunosuppression medications after being on them for 10 years, and they're able to stay off them, which is so exciting because they've been on it so long. So that's a great story. But there is some people who can't come off their immunosuppression. So I do also have one patient who we've tried to taper his immunosuppression, and his lung GVHD does not like that. So we have kept him back on his ideal dose of immunosuppression, and he's able to work and he's able to do everything that he wants to do. So that's exciting for him, because although he can't get off this medication, he's still able to go back to the job that he loved, and he's happy.
That's the truth. Well, Krista, this has been so great. I think there were so many pearls here, and you're doing such a great job. And I know that you're making a big difference, and we really appreciate your time today.
Thank you so much. I would like to thank the National Bone Marrow Transplant Link for the opportunity to educate listeners about chronic graft-versus-host today. Thank you.
Thank you, Krista.
This has been the Marrow Masters podcast. If you know someone who would benefit from the information in our show, please share this episode with them. And don't miss future episodes of our show. Follow Marrow Masters for free on Apple Podcasts, Spotify, YouTube, or wherever you're listening right now. And to connect with the National Bone Marrow Transplant Link, visit nbmtlink.org or tap the link in our show notes.